Hi, my name is Tammy, and I'm Dr. Adamczyk's medical assistant. I have been with Dr. Adamczyk for 3 years, and I've seen some amazing success stories, but I've also seen limitations due to the restrictions that the insurance companies are placing on you and us as your healthcare provider. I've seen the lives of Dr. Adamczyk's patients change drastically. I myself have suffered through the ever joys of menopause, fatigue, hair loss, loss of muscle, my skin sagging, and weight gain. But I no longer have to worry about that because with hormone replacement therapy, I'm gaining muscle, my skin has improved, and I feel fantastic. I have so much energy and I'm full of life. I've watched patients walk into our practice in pain, their joints ache, depressed, they're sad because they don't even have the energy to play with their children. After being on Dr. Adamczyk's protocol, those same patients have walked back in smiling, sharing a picture of a race that they ran or a picture of a family vacation that they were able to take because they were no longer depressed and they had the energy to do it. It is that patient that came in after being on our weight loss program. She put on her sexy black dress and went to her 30-year reunion. It's those success stories and smiles that drive my passion to share the gift of wellness with you and your family, and I don't want an insurance policy or formulary to take that away from us. There are some upcoming changes in our practice, a practice that you are very much a part of. We are no longer just your doctor's office, and you are no longer our patients. We are a family, and a family is a team. It takes teamwork to make a dream work. Let's make your dream work.
I'm both saddened and excited by the changes that are occurring. Many have been my patients for 20 or more years. We've developed personal relationships and friendships over that time. I'm saddened that some of you may be excluded from my care. Many also have had life-changing events, and we've made great strides in your personal care. I'm also saddened that I may not be able to take care of you in the future because of this. On the other hand, I'm excited about the potential changes that can occur. In the past, too often I've had to shorten your visits and put off some of your problems for another time. I've not been able to have the time to really spend with you that I wanted to give you the full level of care that I can provide it. Insurance has largely dictated what's been happening. They dictate how long the visits are, what tests I can order, what treatments I can order, and they're becoming increasingly troublesome so that it greatly limits my ability to help you. With this new model, I'll be able to spend the time that I want with you to give you the best quality of care that I can provide, to provide you with a full program of diet, activity, nutritional support, and hormonal support to get you to your optimal health. In the past, I couldn't afford all these options, but now we can provide even a greater level of care than before. Insurance has been designed to treat medical illness. They want to just put a Band-Aid on the conditions that you have or treat your symptoms, but they're not looking to increase your level of wellness or provide preventative care. They only want to put Band-Aids on the medical conditions that they approve of. This is very frustrating for me because I want to go to the root of the problem. I want to fix the underlying problem and treat it as naturally as possible without putting Band-Aids on illnesses, without determining the underlying cause. It's my goal to provide this care for you, this level of preventative care that is not covered by insurance. Medical care has been a reflection of what insurance covers. Medical care has mostly been putting Band-Aids on illnesses with pills. This is an example of what a typical patient that comes to me looks like. They're just taking a slew of medicines, but they don't feel any better. They're just taking these pills that are just putting Band-Aids on their medical condition, but not really fixing the patient. The patient doesn't feel any better. They still have all the symptoms that they had before, the achiness, the fatigue, the brain fog, the weight gain in the middle, but the medical profession has not solved this. I began to become aware of this in the year 2000 when I was also suffering from following the medical profession's advice. At that point, the common diet was the low-fat diet. Well, the low-fat diet, translation, means high-sugar diet. And I was great at that. I would have churros for breakfast. I'd have a whole wheat sandwich for lunch with ramen noodles. I'd have pasta for dinner. Man, I was an ace at low-fat diets. But the results were that I was not getting better. In fact, I was getting sicker. I was putting weight in the middle, and it looked like this picture. In addition to that, I was pre-diabetic, and I began to question, was the medical profession really guiding me in the right direction? Did they really know everything or not? And I did some research on it. I began to realize that I couldn't take everything the medical profession said as 100% true. And that's inspired me to write this book. After I wrote this book, I began to share my knowledge with other people. And at least in my practice, obesity started to make a turn to the other direction. However, in America, this is not the case. As you see on this graph, obesity has continued to explode over the last 17 years since I started working on my book, and there's no sign of any turnaround. Still, the medical profession answer is, you have weight issues? I'll give you a pill for that. But not really looking at the underlying problems in terms of diet or metabolism that's contributing to it. That's where I differentiate myself. I'm looking to solve the underlying problems. The next clue that I had that the medical profession was not teaching me everything was when I stumbled upon an anti-aging conference in the year 2009. At that point, I was horribly ill. Starting in January, I started going to bed at 11 o'clock, and then 10 o'clock, and then 9 o'clock, and then 8 o'clock, and then 7 o'clock, and then 6 o'clock. And it finally came to the point where I just come home from work and go to bed and crawl out to get dinner and go back. I knew something was wrong, but not what. All the tests that I did, according to the medical profession, were negative. There was no explanation. But then when I went to this conference, it was life-changing for me. I realized that there were a lot of things I didn't know, and that just being normal is not really sufficient. People need to be optimal, and that if you don't really optimize their internal hormonal and metabolic system, you're going to suffer all of those age-related illnesses of the weight gain in the middle, the fatigue, the moodiness, the brain fog, the achiness, everything that we attribute to age, but to a great extent is related to hormonal decline and not keeping those numbers in the optimal range. I started sharing these new renovations with my patients, and again, I started seeing their health and their quality of life and their weight coming in and improving in drastic levels, and that's part of the reason why many of you come to me. We don't offer the same, give you a pill for this, give you a pill for that, but we work on treating you and improving your general health and quality and treating the deficiencies that you have to get you the best level of care. Now, recently, I traveled to Belgium to meet the world leader in anti-aging medicine, Dr. Thierry Hertau. Europe has been far ahead of us in this field, and I had seen him speak before about 2 years ago in an anti-aging conference. He is brilliant. He's written many books, he has his own medical school, and he has an active practice on top of that. He's the most brilliant person I've ever seen. I went there for my patients, because I thought that there could be something that could bring our practice to the next level, even beyond what I've shared with you before. I don't really have the time during conventional insurance to share some of the knowledge that I learned there. But I learned 5 new treatments that are not currently used or readily available in the States, but we can get them. And per my policy, I only experiment on me first. Any treatment that I've given to you, I've tried first. And so I started trying some of these treatments, and I hit gold. For about 2 years, I've had neuropathy in my feet. Within about 2 weeks of starting on this treatment, my sensation returned in my toes, and now it's completely normal. For a year or so, I've had liver function tests were not normal. Nothing I did could fix them, but now, after about a month on this treatment, my liver is now normal. Other conditions have improved greatly. My mental focus has improved greatly. On the weekends, I do lots of researching regarding the medical profession, and I've been wired sometimes for 6 or 8 hours, just unable to stop with mental energy. My mood and sleep are great. When I go to the gym, I'm getting stronger every time. My cardiac performance is great, And when I started this treatment, I was an achy old man, but now I have much less achiness and flexibility. My skin is also looking better. In short, the treatment's been a miracle for me. The downsides of this is it's not approved by the FDA and it's an injectable medicine, but there are other ones even besides this that I'm considering for select patients. This is some of the cutting edge opportunities that I may be able to offer to selected patients if they enter our wellness program. This is something that requires a fair amount of discussion and education to do something like this. But in addition to the level of care that we've provided up to this time, we can even move it to the next level. And with this wellness program and education in terms of diet and activity and kind of lifestyles, we can provide a level of care unequaled in the state of Florida.
Hi, my name is Audrey and I'm the office manager here at Live Longer Wellness. I've had the privilege of working with Dr. Adamczyk for the last 5 years. In my opinion, we are in a healthcare crisis. Our country currently has our government and insurance carriers deciding what the policy will cover and insure for their patient. This policy is based on disease. They are being reactive and not proactive to the disease. In the last 5 years of working in the healthcare field with Dr. Adamczyk, I have seen healthcare insurances deny our patients the care that they deserve and they need. It is very frustrating on my end to see that these patients cannot get the care that they actually deserve. Recently, we received a certified letter of termination of contract with one of our major local carriers of insurance here in our town, which is Health First. When we received this letter, it came as a complete shock to us and our some 300 patients who are also involved in this contract being denied and terminated. I made multiple phone calls to Health First in order to try to understand why they were terminating our contract. However, I was dismissed multiple times, relaying information to me only that it was a business decision and a no-clause termination. This is extremely heartbreaking to me and all of our 300 patients who we have now built an extension of our own family here in this office and seen many of our patients grow since they have been able to spend these years with us and be helped by Dr. Adamczyk's measures. To have their insurance coverage stripped from them like this is extremely sickening to myself and our staff here at Live Longer Wellness. So over the last 5 years that I've worked with Dr. Adamczyk, as I said before, I have seen many of our patients' success stories. First, the patient may come in feeling extremely fatigued, have complaints of overweight, insomnia, anything of that nature. And when we see them, they may feel awful. And then in the next few weeks, we have seen such a change in them when they come into our office. And it may be a slight change, it may be a drastic change just in those few weeks. But it is such an uplifting experience for us to have been able to see those patients, grow with them during that change, and really see their life transform and really be able to get their life back. Because that's really what we want to do here at Live Longer Wellness is give you your life back. We want you to take control of your own health care and it not be dictated by an insurance company. I have such a passion for educating our current patients with the necessary information they need to be able to better themselves and better their lives, to live happier and healthier. Not only that, but me, myself, I am also on hormone replacement therapy. I did not think I needed to be. I'm only 32 years old and I've been on hormone replacement therapy for the last 2 years. Until I received all the education from Dr. Adamczyk, I didn't think it pertained to me. And it wasn't until I actually received all the education and started the therapy, had my labs drawn first, then started the therapy, and now 2 years later, I really do see such a difference. I saw a difference months later in my sleep. I have a very rickety sleep pattern that helped me greatly with my sleep. Also, just in my daily life, I don't get as stressed or overwhelmed as easy. And a huge portion for me of the hormone replacement therapy is I have a 7-year-old son, and Hormones are based on prevention. You're preventing yourself from that disease later in life. That's a huge setting point for me, as I am a mom of a 7-year-old, and it's very important that I'm around long enough to see everything in his life that I can, as long as I can. So I ask you this: are you ready to take back control of your health care? Are you ready to be proactive as opposed to reactive? If so, I encourage you and urge you to please contact Live Longer Wellness and our staff and be part of our team and help us help you get back to living healthier and happier.